Hi everyone, my name is Dr. Monissa Rajasri. I'm one of the family medicine residents down at Town Square and here at KSB. And today I'm just going to be talking to you guys about breast cancer screening and early detection for the KSB wellness. So what is breast cancer? It's a pretty nasty thing, honestly. It happens to many women. In fact, it's the second most common cause of cancer, as well as the second most common cause of death in women. So the recommendation right now is for every woman who is above the age of 40 to be screened with something called a mammogram. So, what are mammograms? Those are x-rays that will help us visualize the entirety of the breast with low dose radiation. And how they do that is by compressing the breast between two plates of x-rays. And although that does not sound fun whatsoever, mammograms, that is one of the most efficient modalities that we have, as it helps us visualize the entirety of the breast and being able to pick up small suspicious regions or anything that's just uncertain. If someone is needing more imaging afterwards, we would target that with ultrasound. And ultrasound is using a scope and then some jelly and then directly looking above the area and target looking. So that obviously seems a lot more pleasant compared to having your breast smushed, right? The reason we don't do ultrasounds from the get-go, however, it's more like a magnifying glass. So if you were to try to use a magnifying glass to see the whole room, it's going to be really blurry and you're not going to really know what you're looking at. But if you use a magnifying glass at a specific region, you're going to be able to see everything and kind of tell whether or not, oh, this is something I should be worried about versus something that this is nothing, we'll just keep an eye on it. So that's the reason why we do ultrasound after mammograms. When it comes to treatment of the any possible masses that we see, it's really individualized, and you want to be able to talk to your primary care doctor about these things, whether because a lot of the things kind of depend on how your clinical picture looks like, what your age, your family history. Do you even want to go through any of the treatment? That's a big thing because we're not going to force you to do anything that you don't want to go through. But that doesn't necessarily mean you're going to have to go through everything, right? So some of the basic things that can happen is that if after an ultrasound we find that, okay, this region here looks a little suspicious, we would like to biopsy, you'll come back in for another ultrasound, but the ultrasound will just help us find the area, and so that we can put a needle through and then go in and get the biopsy. And then based off of that, different things can happen. One of such is that we can do surgery to remove it, like a lumpectomy, which preserves the breast but removes that lump specifically. Or if things were to go in a more southern facet, then it would have to be a mastectomy, possibly even referring to oncology, which is the cancer doctors, and you can go through chemotherapy, radiation, or you may choose not to. It's totally up to you. It's more of a shared decision making, but it's one that we would want you guys to be the most informed of. So the importance of it is that, really speaking, it's a cancer that can be found really early on, and we can basically tackle it before it even has the chance to grow too big to cause problems, symptoms, whatever, what have you. Um, and so it's a conversation that every woman should have with their PCP, regardless of whether or not they have family history. Yes, those with family history have a higher chance, but statistically speaking, given that most of the women don't actually have a family history, it looks like it's more women without family history tend to have breast cancer compared to those who do have a family history, if that makes sense. Um, and so how frequently do we want to be screening you guys for? Ideally, it's every 1 to 2 years. They really haven't found a sweet spot between whether 1 year is the most efficient versus 2 years. That's between your PCP and yourself, whether or not we want to go for every 2 years. or if we want to be a little bit more frequent. Our preference is a little bit more frequent because the more frequent we watch things, the more likely we are to see any problem that's acute or small. Now, there is still more research being done about additional imaging for women who have dense breasts, which is very common. More than half of women have dense breasts. And that can also make it seem like you have suspicious masses. And then every time it makes it feel like every time you go for a mastectomy, sorry, not a mastectomy, for a mammogram, that, oh, there's something we want to do extra imaging for, and then it's kind of like a cycle that keeps getting repeated every year. So that's still being researched in terms of what's the best modality, in terms of how often we should screen for and how often we should be doing additional images for. But that's kind of all I have for you guys today. Thank you guys for tuning in to listen to my little talk about breast cancer screening and early detection.